Hi, this is Dr. John Preston with the Lang International University Clinical Psychopharmacology Program in San Francisco. And today I want to talk about something that happens very frequently when people are receiving treatment for really any psychiatric disorder. This is especially important in people who have bipolar disorder, depression, and serious anxiety disorders like panic disorder, for instance. Uh, what I want to focus on is that, let's say a person has been in treatment and they've been receiving medications and or psychotherapy, and they've actually done well. They either are on the road to recovery or they are in remission, and things seem like they're going well, and then the person comes in for the next therapy session and they're more depressed or they're having a recurrence of panic attacks. Unfortunately, in some settings, there's a knee-jerk reaction to increase the dose of their medication or add another medication on board. Now, sometimes this is necessary, but oftentimes that is not the way to go. So I want to review for you really a list of important variables to take into consideration that might explain what commonly are called breakthrough psychiatric symptoms. Now, some of these are really obvious, but it's amazing to me. I've seen many people for second opinions, and these issues just were never addressed. So I think as obvious as they may seem, it's something that's not oftentimes done in clinical practice. Okay, the first obvious thing is to look for the onset of or increased use of certain substances. Obviously, alcohol is enormously you know, problematic in any psychiatric disorder in terms of increasing the psychiatric disorder symptoms, but also in impairing sleep. Certain things like methamphetamine and cocaine, obviously, but really commonly is increased use of caffeine. And when people get busier, when they have work deadlines, when they're under stress, it's not unusual to gradually move in the direction of increased caffeine use. And the biggest problem with this is that caffeine, whether it interferes with going to sleep or not, is notorious for reducing the amount of time spent in slow wave sleep, also referred to as deep sleep. And sleep disturbances in themselves can provoke significant intensified depressive symptoms and also anxiety attacks as well. Added to the list of other sleep disturbances are things like restless leg syndrome, which, by the way, can actually be caused by many of the antidepressants. When you see this happen, it doesn't usually happen right off the bat. People are taking the medicine for a while, maybe doing better, and then you start to get a breakthrough depressive symptoms. And sometimes it's because it's a side effect of the antidepressant medication. Certain medical illnesses or disorders like sleep apnea may have their onset, and that may account for this. Having a new baby in the home, erratic work schedules, and so on and so forth. So that's really important to check out. Another factor is failure to really comply with medication treatment. And a lot of people stop their medicines or reduce the dose, and for good, understandable reasons. You may experience side effects, maybe the stigma of taking medications and so forth. And oftentimes, when this happens, they're reluctant to really say this or share this information with their treating physician. So that's obviously a very important thing to look at. Increased significant psychosocial stresses. Life doesn't just come to a screeching halt when you're getting treatment. Obviously, medication, psychotherapy, the onset of major losses, significant life changes, and so forth. Turning the volume up on stress can certainly account for this. Changes in the underlying biology, especially important for people who are taking psychiatric medications. And what I want to talk about here just briefly are the things that really affect medication metabolism. So changes in liver functioning. This may be brought about by using certain drugs that affect liver metabolism. It can also be due to illnesses, diseases of the liver. Some drugs rely heavily upon the kidneys to excrete certain medications. This is true with lithium. So looking at these underlying biologic issues that ultimately may have an impact on the blood levels of the psychiatric medications is going to be very important. You can have medical illnesses that are coexistent with psychiatric disorders. One of my professors when I was in graduate school reminded all of us that dogs can have fleas and ticks. And it's not a rarity that a person may have a major depression, possibly been set in motion by some kind of very stressful life event like a divorce or something like that. But over a period of months, as they're getting better in treatment, they have the onset of an underlying medical illness. And probably top of the list is thyroid disease, which can really aggravate depression. Rather than just loading people up with more psychiatric medications, it's going to be important to get some basic medical lab tests, in particular thyroid functioning, also complete blood count, because anemia can really result in profound fatigue. When people are tired, they stop doing things, and that can, of course, contribute to depression in and of itself. Now, what about tolerance for the psychiatric drugs? This is something that, at least current thinking is very rare. It's always a possibility that persons continue to take the same medication but not having the same effect. And two more things I want to add to the list is a person, for whatever reason, has reduced the amount of physical activity. Clearly, moving around, whether it's exercise, going to a fitness center and jogging on the treadmill, and that sort of thing, or simply going out and walking or what have you, physical exercise changes brain functioning. And in particular, exercise appears from research to increase the availability of dopamine and serotonin. And so somebody has become more sedentary for whatever reason. It could be something like, for instance, they sprained an ankle, so some kind of injury. But there can also be lifestyle choices where that's the case. Changing work schedule can be a big thing, especially for shift workers. And finally is the role of bright light. And increasingly, what's been found is that a certain amount of bright light exposure, like you would get from the sun, being outside without sunglasses on, can be tremendously helpful for people that are suffering from mood disorders. Now, two cautionary notes here. One is, we're not talking about going out and getting a suntan. It's going to be important to go outside to put on sunscreen and that sort of thing. But go out, and it's the light energy going through the eye into hitting the retina that matters, so not wearing sunglasses. The other thing is that with bipolar disorder, excessive exposure to bright sunlight can provoke a manic episode. So these are a host of factors. It's not all inclusive. There are probably other explanations as well. But I think it behooves us to really, rather than immediately jack up the dose of the psychiatric medications or start loading one medicine on top of the other, is to sort of back off, reevaluate, and go through this list of things that, in fact, oftentimes do account for breakthrough symptoms. Okay, thank you for listening.